All right, good morning, everybody. Thank you all for being here with us today, and welcome to the White House. I have the pleasure of working with all of you throughout the year, and I'm so grateful and honored that you would join us, and I will be guiding us through our 2 days of discussions today. During our time together, we will learn more about how synthetic drugs are affecting North America and share effective public health policies and tools to help improve the health and well-being of communities throughout our region. And now I would like to welcome Dr. Gupta, the Director of National Drug Control Policy, to open our North American Drug Dialogue Public Health Summit. Dr. Gupta is the first medical doctor to lead ONDCP. As a practicing primary care doctor for 25 years, Dr. Gupta began his career in private practice in an underserved community of fewer than 2,000 residents. Prior to ONDCP, he was the Chief Health Officer in West Virginia, where he led opioid crisis response efforts and launched a number of pioneering public health initiatives. Dr. Gupta.
Good morning. Thank you all for being here. I know that several of us have traveled and some of us are still in the process of travel, so I appreciate all the work that has gone and for being here. On behalf of President Biden and Vice President Harris, I'd like to welcome you here to the White House for the North American Drug Dialogue Public Health Summit. We're here today to continue the mission that President Biden, President Lopez Obrador, and Prime Minister Trudeau set at the North American Leaders Summit in Mexico City this past January. And that's to collaborate more closely than ever to address the illegal drug threats facing all three countries and to strengthen our public health approaches to substance use. Since that meeting, we have worked closely together on these issues, including holding the first North America Trilateral Fentanyl Committee meeting in April and preparing for today's summit. Additionally, President Biden and Prime Minister Trudeau met in Montreal in March and both committed to fighting back against the deadly fentanyl entering our communities and tearing the families apart, and building a global coalition to disrupt illicit production and distribution of synthetic opioids and taking a public health approach. When I visited President Lopez Obrador in March, he told me how important it is to embrace a broader public health approach to this scourge, including addressing the social determinants of health that play such an important role in this crisis, including access to employment, housing, food, healthcare, treatment, transportation, and so much more. Today, we're here to do just that. Look at how our collective response can be improved and the role that data collection has in saving lives. I want to thank the staff from all of our three countries for the countless hours of work that has gone into making sure that we are all continuing to make progress and hitting our goals. And let me just say that as the first medical doctor to lead the White House Office of National Drug Control Policy, I can tell you that we cannot be meeting at a more critical time in history. I want to thank each of the three leaders who will be joining our Secretary's panel this morning: Dr. Carolyn Bennett, Canada's Minister of Mental Health and Addictions; Dr. Jorge Alcocer, Mexico's Secretary of Health; and Secretary Xavier Becerra, the United States Secretary of Health and Human Services. I work closely with Secretary Becerra, and I can tell you as a friend, as a professional, he is addressing and he knows that this is a top priority for him. Thank you, Secretary Becerra. I also have spent a great deal of time working with Secretary Alcocer, and he is committed to addressing this crisis and its effects on the Mexican people. Most of the times, they're through Zoom calls. But thank you for your work on this as well, Secretary Alcocer. And then I know that Dr. Bennett has been so focused as well, and we work closely with Minister Bennett's team, and I look forward to working with her more as well. Thank you. So today's summit is needed because the global and regional drug environment has changed dramatically from just even a few years ago. Criminals today ship precursor shipments, and they're manufactured into deadly synthetic drugs like fentanyl and methamphetamine, and the Mexican, American, and Canadian people are paying the price. We're seeing unprecedented numbers of people lost to overdoses and poisonings, not only here in the United States, but also in Canada and now in Mexico as well. Synthetic drugs have truly become a global threat, and we are building a global coalition against them because everyone is affected. Today, you can divide up the whole world into 3 types of countries. Those that have a synthetic drug problem and know it, like the United States and Canada and Mexico. Those that have a synthetic drug problem and don't know it. And lastly, those that don't have a synthetic drug problem yet. And that's why our Secretary of State, Tony Blinken, will be hosting a ministerial level conference next month to coordinate this global coalition's objectives and operations. Today's summit is focused on strengthening our regional public health approach to this threat. This includes tools such as medications to reverse opioid overdoses, as well as harnessing the power of data to guide our approach. That's because we know we can't solve this problem without making data a top priority. For example, look what we've accomplished during the COVID-19 pandemic. We faced an unprecedented threat with no tests or treatment when it began. Well, we developed tools to track its spread around the globe. We developed tests. We developed vaccines. We developed treatments, all in a remarkably short amount of time. And data guided all of this work. In the United States, we're using data to guide our approach to the opioid crisis. We know that over 108,000 drug poisoning deaths in the last year are just tip of the iceberg. Under the surface of the iceberg, there are many times the number of non-fatal overdoses, and further down in the iceberg, there are 46 million Americans with a substance use disorder. It's a story very few people know, and it's exactly why our public health approach includes expanding access to overdose reversal medications like naloxone, and expanding access to treatment like never before. If we can save those 108,000 people here in the United States, if we can get them and hundreds of thousands of others who experienced non-fatal overdoses into treatment, and do the same for the 46 million Americans who have a substance use disorder, if we can provide access to recovery support services for everyone who needs them, we can stop this crisis from tearing families and communities apart. Now, as a practicing physician, I realize that medical treatment is a critical part of achieving recovery for so many people, but also there's so much more to it. It's about employment. It's about housing. It's childcare. It's food security, education. It's economic opportunity, and so much more. And that's why we're here today, to improve our public health response to synthetic drugs and build a healthier North America. Let's just face the facts. Illicit drugs are the most pressing drug threat to the collective health and well-being and security of our region. But by working together, we can push back. We can disrupt the dynamics of illicit synthetic drug production, trafficking, and its use. We can hold criminals accountable. and we could provide help and hope to all those affected by synthetic drugs. And we could keep families and communities whole. And we can make sure that loved ones still will be there at the dinner table, at birthdays, holidays, and all of those life's most important events that we all cherish. So thank you all for being here for this important discussion, and thank you to everyone watching online. It now gives me great pleasure to officially open this summit and invite my distinguished colleagues, Secretary Becerra, Secretary Alcocer, and Minister Bennett, to start us off with an overview of how synthetics, especially opioids, are affecting our region. Their presence here and the numbers of experts today that are gathered at this table is the testimony of how important the North American drug dialogue and the importance that it places on public health responses to reduce devastating health, social, and economic harms that synthetic drugs are causing our region and beyond. And I'll end with this. President Biden often says this. I'll repeat it because it's worth mentioning over and over again, that there is nothing we can't do if we work together. So thank you.
Thank you, Dr. Gupta. I'd now like to welcome our Secretaries of Health for our opening panel, starting with Secretary Becerra, who's the 25th Secretary of the Department of Health and Human Services. Prior to serving in the Biden-Harris administration, Secretary Becerra served 12 terms in the United States Congress and served as the Attorney General for the state of California. Dr. Alcocer has served since 2018 as the Secretary of Health for Mexico. He's a medical doctor specializing in immunology, a researcher, and a distinguished professor, and we're fortunate to have him with us today. It's also my pleasure to introduce Dr. Carolyn Bennett, Minister of Mental Health and Addictions for Canada. Dr. Bennett has a long career as a practicing physician and also served several terms in the House of Commons. Dr. Bennett, thank you as well for joining us. Now, Secretary Becerra, the floor is yours.
From here?
Yeah, from there.
Eric, thank you very much. Good morning and welcome to everyone. Bienvenidos a todos. I am thrilled to be here today with Secretary Alcocer and Minister Bennett. I thank them for their visit. It is a lot easier when you get to do this from home, and so I understand the travel and I appreciate that you and your teams have come. I want to say to each and every member of your teams, muchísimas gracias. Thank you so much for your effort, for the consistent and persistent endeavor to try to tackle this. On behalf of the U.S. team, I want to say so much gratitude must go to you for the work that you do day in, day out. Certainly, I know my team, many of whom are here at HHS, we take this very seriously. We treat it as if it were family. I know that Minister, Secretary, you do as well, because in many ways it really is our family. And if we don't act, tomorrow might be a day where we are all saddened because it really was our family who was impacted. So, Eric, thank you very much. And to Director Gupta, Dr. Gupta, thank you so much for your consistent emphasis on trying to deal with all aspects of the issue of drug and drug abuse. And so thank you very much for that. I'm going to go through a few of the things that we've done in the United States and also within the Department of Health and Human Services. I believe it's important for me to first acknowledge a few of the people at HHS who have been at the forefront of our efforts. I want to acknowledge our Deputy Secretary and number 2 in charge, Andrea Palm, Dr. Miriam Duffin-Rittman, who is sitting at the table, who runs our agency that deals with mental health and substance use disorder. And I want to recognize Admiral Rachel Levine. Dr. Levine is our Assistant Secretary for Health. Within the organization at HHS, there are many others. I could go down the list, but it would take up my entire time. But they have all been working hard. And that's because this is a top priority for the Biden-Harris administration. It is also I think by the attendance of folks from HHS, clear that this is a top priority for the U.S. Department of Health and Human Services. I'm proud to say that at HHS we are playing a leadership role in this whole-of-government strategy to address the overdose crisis in our country and across North America. The epidemic, as I mentioned earlier, is heartbreaking and preventable. In America, in the U.S., more than 109,000 Americans died last year from drug-involved overdose. About two-thirds of those involved synthetic drugs like fentanyl. Tens of thousands more died from overdose from other drugs here in this country. I have heard many stories. I've met with many families. The despair is there, but the will to fight on is also visible in these families as they watch their loved ones battle addiction, many of them battling addiction more than once. I'm sure we all have had these experiences. The tragic number of overdose deaths have devastated so many families and so many communities and economies. Of course, we're here because Canada, Mexico, and the U.S. have a shared interest in dealing with this crisis, and the more closely we work together, the more effective we will all be. This event was first conceived during the 2023 North American Leaders Summit when President Biden, Presidente Obrador, and Prime Minister Trudeau agreed to continuing collaboration within the North American drug dialogue. The leaders agreed that a regional approach to deal with the drug overdose and addiction crisis is critical as our populations are intrinsically linked. Of course, our work together between the health leadership of our three nations has been consistent throughout our time in office. We have and we will continue to share intelligence to improve the accessibility and distribution of overdose prevention medications as one of the tools in the comprehensive treatment of overdose. We have and we will continue to improve data collection, the sharing of information on current and new trends in drug use, and collaboratively address data and evidence gaps in the policy and programmatic decision-making process nationally and regionally. Our approaches and the regulatory and legal frameworks within each of our countries might be different, but there's no question that a deep commitment to this work is shared by all three nations. Let me take a couple of minutes to outline what the U.S. is doing to address the overdose crisis. Last year, the President released the National Drug Control Strategy, which outlines a whole-of-government approach to beat the overdose epidemic. This strategy continues to deliver on the Biden-Harris administration's promise to build back better and healthier. The strategy focuses on two critical drivers of the epidemic: untreated addiction and drug trafficking. At HHS, we are embracing the President's challenge and prioritizing actions that save lives, get people the care they need, and make better use of data to guide all these efforts. Our vision is simple. It's time we treat addiction like any other disease. That's why HHS's overdose prevention strategy calls for an increase in access to the full continuum of care and services for people who use substances that are causing this overdose. The strategy has 4 pillars: primary prevention, evidence-based treatment, harm reduction, and recovery supports, and focuses on the diverse array of substances involved in overdose, as well as diverse treatment approaches for substance use disorders. Since the President's strategy was released, the nation has made progress. We have expanded treatment capacity and redoubled our commitment to long-term recovery supports. The nation has increased its capacity to save lives from overdose since the release of our strategy by making it easier for people to access this life-saving overdose reversal drug so that they can help save a life. And we have taken bold steps to ensure equitable access to care and to reduce stigma. As we move forward to address our nation's overdose crisis, we must consider those who have been denied opportunities and are disproportionately impacted by poor access to quality health care and roadblocks to their well-being. We have not made progress unless we have all made progress together. This administration is deeply committed to addressing this crisis. This is a value reflected in the President's budget. President's fiscal year 2023 budget supports $42.5 billion for National Drug Control Program agencies to implement the administration's drug control policies, with more than $21 billion of that money for HHS and its agencies. That's a significant increase over the previous years. And the FY 2024 budget includes even more funding to bolster the nation's behavioral health infrastructure, our crisis response capabilities, and our long-term investment in recovery support services. These funds are used to significantly expand efforts related to primary prevention, evidence-based treatment, harm reduction, and recovery support services across HHS programs, our 4 priorities. We are also investing in the nation's behavioral health infrastructure, including more than doubling the funding directed towards access to recovery support services. We cannot rest as long as tens of thousands of our loved ones are dying each year from overdose deaths. So we continue the fight to address addiction as a public health crisis and to support every person who has been affected with skill, compassion, and urgency to address their needs. HHS's approach to overdose prevention puts people at the center of the care. But it's going to take all of us to make sure Americans in this country, Americans in Mexico, Americans in Canada, or of the North American continent, have the prevention, treatment, and recovery resources needed to keep their families healthy and whole. I hope we can use this unique opportunity to find common ground, to tackle this challenging public health crisis, to stop more innocent lives from being lost. Thank you again to Dr. Gupta, to my counterparts from Canada and Mexico, and to everyone here today. It is an important moment in this fight, and we have the leaders and public health experts here together to find real solutions. I am confident in our ability to press ahead on this critical work with our partners within and outside of government, here in the United States and across North America, and we're here to save lives. I look forward to our discussion. Thank you.
Thank you so much, Mr. Secretary. Next, we will hear from Secretary Alcocer.
Thanks. Buenos días.
Good morning. On behalf of Andrés Manuel López Obrador, the President of Mexico, I would like to extend greetings and to commend us all for being here to meet about a priority matter for the 3 governments represented here. I would like to thank the U.S. government for its hospitality, and I would like to extend my greetings to Dr. Rahul Gupta, Dr. Xavier Becerra, the Secretary of Health and Human Services of the United States, and Carolyn Bennett, who is the Minister of Mental Health in Canada. Drug trafficking and use and the violence that it causes is a major problem in our 3 nations. Today, fentanyl and methamphetamines are a major threat to all of our countries. The United States has a complicated public health problem, and Mexico is fighting organized crime cartels that traffic drugs and use high-powered weapons. This is a threat that we are combating on a daily basis. Nevertheless, here we will have the opportunity to consolidate the cooperation amongst our 3 countries so that we can share experiences and discuss potential solutions to prevent the serious harm that the use of these substances can cause to our populations. In these dialogue, it comes from matters of security in our region. Mexico has continuously fought to ensure that public health is a priority on the agenda of the discussions amongst the 3 countries. And today, With the holding of this summit, we've seen this come to fruition. We are aware of the major harm that drugs can cause to our populations, particularly children and adolescents. We are not just aware of this, we are working to ensure health amongst our population. And to this end, President López Obrador and all Mexican agencies have taken on a firm commitment to prevent the use of drugs and to reduce the abuse as well as the reduce harm associated with addiction and to provide support for recovery and treatment through the National Strategy for the Prevention of Addiction, Together for Peace. EMPA, which is what we call this institution in Mexico, brings together all of the efforts of government in a whole-of-government approach and are part of the presidential initiative that seeks to prevent and reduce the use of psychoactive substances among children and teens, to consolidate peace, which is one of our country's major desires. This initiative is attacking the issues at their root and not just the consequences. We know that drug use is associated to many social, economic, and emotional factors, and even cultural factors. And that is why all sectors must be involved in the implementation of the national strategy. Mexico has an extensive network of care through 376 centers for public and mental health care. We have 227 residential establishments that provide addiction treatment. We provide treatment in mental health throughout the health sector, as well as remote and virtual care through social networks 24/7, 365 days a year, nationwide in Mexico, and sometimes even overseas to provide support to those who live outside of Mexico. This great national effort has been part of a recent campaign launched by the Secretariat for Public Education to prevent the use of substances such as fentanyl among young people. This is a campaign that is aimed at middle school and high school students as well as their families and their teachers. We are implementing actions as far as regulating those substances is concerned. We have regulations on the sale of opiates and other medications to address mental health issues. Mexico believes that our regulations have helped us to not reach an alarming stage in issue. Nevertheless, we cannot let down our guard. Mexico believes that access to those medications should be to the benefit of those who need them. Nevertheless, the regulation should not allow for these to be diverted for other purposes. Nowadays, we are facing a great enemy that can cause problems with our youth and unleash social problems. These are synthetic drugs, and today it's fentanyl. Nevertheless, and undoubtedly in the coming years, we will see another drug come on the scene, and it will cause even greater harm if we are not attacking the root causes and involving families, communities, schools, teachers, and all the aspects of society. In the specific case of fentanyl, Mexico, I've seen about 318 individuals who were referred to treatment for fentanyl use in 2022. It is important to underscore that we've seen an increase since 2013, where we had 5 reported cases, and we've seen similar or lower numbers until 2018. In 2018, there were 10 cases, and then that jumped to 25, 73 in 2019 and 2020, respectively. We have seen greater increases starting in 2021, 184 individuals, in 2022, 318. While each of our countries have different figures and statistics, different situations, different policies, the issue and the concerns remain the same. The well-being of our people, particularly our children and young people. This reflects that the 3 countries can and must work together for the common good for our communities. Before wrapping up my remarks, I wanted to point out a recent event that has led us to great satisfaction and has shown some positive results of our approach to addictions. This was meeting a target that we set for ourselves at the beginning of this administration that was reached on May 29th through the publication of a decree from the National Commission on Mental Health, the objective of which is to ensure the right to prevention, control, and care for mental health and addictions in Mexico. This is a community-based approach, primary care approach, which also respects human rights, intercultural elements, and the respect for the individual. This shows Mexico's interest in being innovative and in working with partners like the United States and Canada. We have seen success stories in our 3 countries through different actions implemented to reduce harm. Lastly, I would like to underscore the fact that we cannot cast aside the problematic use of substance and how it needs to be attacked at its roots. This is a mental health issue that involves many different factors. Our mission, to a great extent, will be to return to our young people these opportunities for growth, emotional growth, personal growth, for their well-being, their physical health and their general health. Opportunities that had been lost thus far. We are very pleased to be here, and we are ready and willing to hear from everyone. Thank you.
Thank you so much, Secretary Alcocer. We very much appreciate your words this morning. And now we'll turn the floor to Minister Bennett.
Thank you, and I'm Carolyn Bennett, Canada's first Minister of Mental Health and Addictions, although some of our provinces went ahead doing this, and we were actually catching up as the federal government having a separate Minister of Mental Health and Addictions. I, as you heard, am a family doctor who accidentally ended up in politics because of the fight for the Women's Hospital in Toronto, which had decided that we had to go to more multidisciplinary hospital to community, patient at the center of their care, but also the focus on social determinants of health, of poverty, violence, the environment, shelter, equity, and as we gather here on the ancestral lands of the Nacotchek and the Piscataway people, as we pay respects to the elders past and present, I, as a physician, always am humbled by understanding that maybe what I learned in medical school in terms of how to run a repair shop was not exactly going to keep our country well, and that when you think of the medicine wheel and how the Indigenous people wanted to keep people well throughout the life cycle, mentally, physically, emotionally, and spiritually, and to find that balance. That is really what we're trying to do in all humility. And I think Secretary Becerra and I had a wonderful dinner at the U.S. ambassador in Geneva at the WHA meeting, where we were all sort of coming together, understanding that this keeping people well piece is hugely humbling. I fondly remember being, I think, on the second floor here in 2016 when our three countries came together in the North American Working Group on Violence Against Indigenous Women and Girls. And I'm reflecting that again, we were talking about a whole of government approach, that just one department wasn't going to be able to fix this, but also that it was a public health approach. And we're grateful to Dr. Gupta for really reinforcing the fact that this it has to be public health. This is a crisis that is heartbreaking for all of us, the communities across the three nations, and our hearts go out every day to the people who've lost loved ones to the crisis. And I just wanted to say I'm very proud that Jen Sachs and Shannon Nix and Katie Falloon-Drew and Patrick Picard from our embassy are here because I know they have good relationships with all of you, and that we will keep the work going between meetings, and that's always so important as they try and make us look good. I think in Canada, and we are trying now to understand that when we talk about public substance use as a public health crisis, that we are most often talking about trauma, that we've been asking the wrong question, what's the matter with that person, instead of what happened to that person. And so if we look to, and I find that is a dialogue that I can have with people who maybe are more ideologically driven, but if you think that people have needed to numb out either their physical pain or their psychic pain, that we can find the compassion that it's going to take to move this through. Our most recent statistics was that since 2016 to September 2022, 35,000 opioid toxicity deaths in Canada. At the same time as COVID, people are seeing this as a significant number. And that it's taking 20 lives every day in our country, and it is our beloved children, parents, neighbors, friends, and colleagues. And I think we're starting to see, like we saw in Portugal 20 years ago, that people are changing their minds about this because it's no longer a they problem. It's no longer othering. This is a we problem. It's happening to people we know. It's happening to the debate in the House of Commons. Almost everybody had a story from all parties as how this was touching them. And we know that this is now because that, as we saw, people in Portugal had been addicted to heroin for 20 years and they died of something else. This is because the drugs are toxic, they've been poisoned and laced in with the fentanyl, but also in our country, carfentanil. But when we look at what the drugs are being seized, it's by the law enforcement and border officials and the testing. They also have benzodiazepines and xylazine and are now making the reversals with naloxone much more difficult. We have frontline providers saying that it takes 4 doses sometimes of naloxone to be able to revive somebody because of the benzos in there, which also makes withdrawal and the detox much more difficult because they're long acting and the detox is much more unpredictable. And so we are now, I think, having to update our Canadian drugs and substances strategy. We did in the mid-COVID crisis on opioids, appoint an expert task force that issued 2 reports in 2021, which provided us, I think, with independent recommendations that included not only health providers, but police, and to be able to get that blend of public safety, public health advice. And it was pretty clear that they don't want us to keep doing the same things. It's not working. And they were saying that it had to change, that our policy on substances had to change significantly, and that bold actions were urgently needed. They talked about law enforcement as an effective tool in supporting equitable, evidence-based regulation policy, and stressed, as we are here today, that we must work towards reducing the importation, manufacture, and trafficking of currently illegal substances and their precursors. So Canada supports the 4 foundational and internationally recognized pillars of drug policy: prevention, harm reduction, treatment, and law enforcement. And over the next year, we will be updating the strategy so it reflects on the evidence and current realities as continue to guide our work to save lives and protect the health and safety of Canadians. It's increasingly evident as we travel the country and as we were chatting outside that the complex cases with mental illness and substance use are really challenging, but that requires an integrated care with supportive housing and developing a community that helps one another stay on their meds. And we've seen that many jurisdictions have now added a 5th pillar, which is social reintegration. And so that we actually need to understand, as we've said, if we're going to talk about whole of government, are we getting the mental health literacy into the school system, but are we getting the supportive housing from our housing departments? How do we really have all of our colleagues across government departments understand they've got to be part of this as we raise the mental health literacy of our citizens, but as we saw in Denver and last summer, that also of our police force, who now maybe understand mental health a little differently or substance use a little bit differently. How do we get this everybody's job to keep people alive? So we know that law enforcement and border officers require the necessary tools, and so this week we have permanently scheduled a group of the novel fentanyl precursors under our Controlled Drugs and Substances Act, known as the analogs and derivatives of 4AP. And we think that, this is part of a comprehensive approach that wants us to both respond to but anticipate, as the Secretary said, we are up against people who can pivot much more quickly than government in terms of organized crime and gangs, and the people selling the stuff are going to be faster than we are. So how do we anticipate what they're going to do next and be able to be preventive and head it off? So it is, we are, in terms of our advice around significant bold action, significant policy shift. So Shannon here and Jen are part of a substance use and addictions program that is able to fund directly the innovative projects that communities have decided they need. But we also insist that they actually are producing the data, working with our Canadian Institutes on Health Research to be able to track these innovative programs, because I think we all know in this room that best practices isn't just a good idea. We actually have to be able to prove that they work, and we have to do what works and stop doing what doesn't work. So it's what we're calling learning health systems throughout our health departments, integrated evidence-based and patient-centered mental health and substance use services that again, the mantra, the most appropriate care in the most appropriate place by the most appropriate person at the most appropriate time. And the place sometimes is virtual now. And I think we learned that during COVID. So, I don't think there's anybody in this room that knows that people who use drugs need support, not judgment. They need community, not isolation, you know, addiction, connection, you know, these are what we have to do. And it is about empathy and understanding and stigma and prejudice. And we're finding in some of our real effective programs around safe consumption, around safe supply, that this is really the first trusted relationship this person's ever had. Somebody who actually wants them to stay alive, and that when you build that trusting relationship, then it's easier for people to think about a life beyond the hustle, and for them to be able to think about a safer and healthier life. So since 2017, over 70% of our investments to address the crisis have been committed to increasing the life-saving harm reduction and evidence-based treatment services, and I would be not honest if I'll say we're still fighting that in House of Commons every day. People still, you know, are uncomfortable, but we, I think, have to move on evidence, not anecdote. And so this is, I think, why we're really trying to get the data we need. So it means that as we fund provinces and territories to improve the lives of people who use drugs, we know that we've got data on wait times, we've got Stats Canada data on unmet mental health needs, but we know we're going to have to develop better indicators for what are the community supports as we ask the provinces and territories to develop their action plans with the money that we're sending in this most recent budget. So access to the rapid access addictions medicine clinics, lovingly known as RAM clinics, improved access to the opioid agonist, and improved targeted approaches to people at risk. So First Nations, Inuit, Métis, the 2S LGBTQIA, the youth, racialized communities, and we're pretty excited about what now has become a movement across Canada on integrated youth services. These are kids 12 to 25. It's a youth-led approach. They pick the color on the wall. They pick who should be there, but it's a stepped program that starts with peer, meaning somebody who's been there, done that, lived and living experience, but primary care, social work, psychologists, psychiatrists, addiction medicine, but also help with employment, housing, education, and that we are seeing that now all 13 of our jurisdictions have signed on to this, and that we are moving into a network of networks where there is the data to show that this works. We are also particularly concerned about the number of young men in the trades that are dying. They're using alone, dying alone, and our public education activities are targeting men working in these physically demanding jobs. I personally, as a family doctor, am concerned that some of these guys were cut off their meds after they fell off a roof, and then go to the street for their drugs and die. And so what are we going to do to help people make healthier choices? And that's where I think in Berlin and other places we've talked about, they talk about substitution therapy, where we actually need that extra pathway. So I was really impressed this spring. We were in the Carpenters Union in Victoria, where they're giving out naloxone kits to every new member. They didn't win when they said, in case you need it, you will have it. They won by saying, you could be a hero, you could save a life. And they're all taking them. And so so in 2016, we made naloxone available without a prescription in Canada. All of our provinces and territories offer a take-home naloxone program, which is available free at pharmacies. So, but also we have St. John's Ambulance and Red Cross and everybody doing some of the training. But anybody can get a naloxone kit, and And the debate right now is that the injectable one is so much cheaper than the nasal one, which most people would feel much more comfortable administering the nasal than an injection. So it is hugely important as we move to actually move on, the worrying in terms of what is in the drugs that are it's scary for somebody to try and administer it, but it's scary if they don't respond. And so because of the benzos in it, that we are quite worried. We, in the last 6 years, with our safe consumption sites, we are seeing that less and less people are injecting, more and more people smoking and inhaling, and it means that our safe consumption sites are a bit expensive because you need the occupational health and safety hoods or ventilation systems that mean that if people are really the trend to no longer inject, we've got to be able to help them. But what we're also finding in the last 6 years, that 4.1 million visits, but we've reversed 46,000 overdoses. And I guess that's the number I don't know how anybody can argue with. That at 46,000 overdoses reversed, these are people who left the safe consumption site alive. I think that we are continuing to listen to those with lived and living experience. They know what'll work and what won't, and how do we move to this health-focused, compassionate policies that actually listen to the people who know. So, as I think some of you know, in British Columbia, with the support of the chiefs of police across Canada, we have begun a 3-year project which decriminalized small amounts of certain drugs for personal use. So, and according to the police, so that the law enforcement can focus on the major dealers in organized crime. And what we're doing now is that the BC Centre for Substance Use will closely track both the public health and the public safety indicators. So petty crime going down, our ambulance visits, our emerge visits, like how do we show on a dashboard shortly exactly what's happening now with the support of the police. So I'm hugely looking forward to the next 2 days as we look at how we improve the data collection in each of our countries. What does the monitoring look like? I think we all know that with the data we can analyze and prepare for how to combat this crisis as we move forward. I think all of us are trying to persuade our colleagues in terms of that data saves lives and that we actually need the resources to get the data, and we need people on the front lines to not have to be doing this off the side of their desk. It has to be easy that we get the data because they are busy saving lives. And so I think as Secretary Becerra and I were at the World Health, it was quite clear that post-COVID mental health has become more of a central conversation. Maybe stigma comes down a little bit, that people are more likely to talk about their mental health or their substance use. Can we use this moment to move? And then I think that later in Lisbon, we really did dive into Portugal's 20-year experience with decriminalization and the Dissuasion Commission. It was inspiring to learn how seriously they worked on social reintegration as their 5th pillar, with the brings in housing, employment, and social supports. And I guess I was very impressed that the methadone clinic sites, both the shelter and the mobile van under a bridge, also had the laptop capacity to get people their HIV meds, their Hep C meds, and their antipsychotic meds. And so, this was a sort of one-stop that it's almost methadone got them in the door, but that we were also able to deal in a more holistic approach. There we also met with Alexis Goudsdil, the director of European Monitoring Center for Drugs and Addiction, who was clear that we need the monitoring, preparation, capacity development, and international cooperation. But he actually saw his role to anticipate, to alert, to respond, and then to assess country by country in Europe. And so I think that we have this opportunity in the collaboration across the 3 countries to actually be part of anticipating together what we might see as we make significant progress, we hope, in the face of this devastating epidemic. I think we have to remind people that this is like the HIV/AIDS and Hep C epidemics, that back then we pushed for needle exchange and then clean cookers and crack pipes, and we had to fight about naloxone. And every step we took, we were fighting against the ideology, and I'm embarrassed to say that we are still facing some of that ideology in our prisons. So the challenge is that, is equally daunting. It's just more immediate. They're dying the same day. And so we have to have the courage to go further and bolder and do everything possible. I think my life is to prevent the preventable. So what do we do to prevent the preventable? As I have been saying probably for way too long, there is no recovery model for people who are dead. So we have to keep them alive long enough so that they can see a life. And so it is going to be with greater international cooperation that we will be able to respond accordingly and continue together to assess what's working and what's not working. We know that these discussions are going to have to go forward, but I hope over the next 2 days we can talk about also what we tried that didn't work. Because I think that sometimes we're a bit quiet about that. Even our Auditor General says, I wish the front, each department, maybe on page 1, the things that you did that didn't work that no one else needs to try. But, I think that we found in our country the 30-day treatment doesn't work, and particularly without appropriate aftercare, that it's failed. And so we have to just really be honest about, my brother-in-law runs an on-the-land treatment program in Alberta. The research that actually came out of Washington State and University of Georgia showed it wasn't until day 57 that these people could see their life without drugs. So we need evidence. And so I think that it is so great that the leaders of our 3 nations committed to the North American Dialogue on Drug Policy. I think it's appropriate to reiterate Canada's support for the Trilateral Fentanyl Committee and the Global Coalition Against Synthetic Drugs. And I think we're all here because we know there's lots more to do, and that we have to deal with this poison drug supply that's killing so many of us. And so it's an honor to be with you, and look forward to listening and learning. And merci beaucoup, muchas gracias, and thank you.
Well, Dr. Gupta, Secretary Becerra, Secretary Alcocer, Minister Bennett, thank you so much. Your presence here today, I think, demonstrates the priority that these 3 governments place on this issue, and your personal engagement makes a real difference, and we're glad to have you here with us today. This ends our opening session and will end our live stream, and so we thank you all for joining us, and let's give everybody one last round of applause.